Would you like a second opinion on your diagnosis? Please send your analysis and medical history to visite@qs24.tv, and our Chief of Medicine, Miss Dr. Veekal, will analyse them for free and anonymous in our new series Ward Round. For more information, visit qs24.tv. Welcome again to our new episode of Ward Round. And thank you very much for all your valuable questions, which I try very hard to answer. And I want to get started right away. So, one question was that there is always a nosebleed. Now, the body is always in the situation that it helps itself first. And a nosebleed that happens frequently is just a compromise it has to make, because it's actually not optimally cared for now in the context of its excessive demands or adaptation. This means nosebleeds are very typical for high blood pressure, because high blood pressure is connected to increased vascular pressure. And of course, through a nosebleed, it is a significant relief. If it happens in accordance with an increased blood pressure, then one can do a small bloodletting every month after the full moon. That means, in a little bloodletting, according to Hildegard von Bingen, blood is really drained through the vein, about 150, maximum 200 millilitres. It's not about donating the amount of blood at all, but about lowering the pressure peripherally, so that a certain detoxification process starts, but also prevents the pressure gradient. Patients in our clinic with high blood pressure are treated like this. So immediately the bloodletting, and then there is an insane decongestion, relief, and we give high-dose magnesium because magnesium is relaxing. And that, of course, also significantly reduces the massive pressure. If blood pressure is, of course, incredibly high, let's say over 200, then, of course, you have to react. And those are people treated with medication very quickly. But if it is unstable and the nosebleed occurs due to the high blood pressure, then you always have to keep in mind, I have to keep working on it, that my blood pressure can slowly decrease. And this is not always just with blood pressure medication, but also blood pressure can be looked at. We often find high blood pressure values in patients who are under psychological stress. Of course, I have to treat this in a different way and give them peace and quiet again. And of course, the other thing would be that it is not only in the tension, but that the body is also too stressed and toxic. Mercury clearly causes high blood pressure, and a blood pressure treatment alone can't solve the causes. But that would be a new topic, a different topic to talk about blood pressure. But I just want to bring up option A if you have a nosebleed over and over again. The other thing is that we humans are all of a different stamp. This means I work a lot with the eyes. That means iridologically you can use the eye colour to recognise the constitution of a person. And I like doing it with children, because you can see what strengths children have, but also what weaknesses do they have. And a blue-eyed child has a silica constitution. The constitutional agent is silica. The silica is the strongest and best body mineral, besides calcium, for example. That gives skin, hair, connective tissue, mucous membranes and bones a lot of structure. And these little ones have also, mainly on their mucous membranes, they are not as quick as others in the texture work. And this structure, this process, like connective tissue and also skin and mucous membranes, you can stabilise with children at an early stage with organic Schussler minerals, that is number 11. When they grow, when they get bigger, when they stretch, then they can't follow with the elasticity and with that stability of their mucous membranes. And very often this causes a nosebleed. And this nosebleed can, of course, also be stabilised very well with silica by simply prescribing it to the children or even an adult so that the nasal mucous membranes become firmer again. There's also silica in the form of a cream. This means the nose is then also internally stabilised by the cream. But the healthy nasal mucous membranes always need good minerals. And if you now make yourself a Himalayan salt brine, 27% from a chunk of Himalayan salt, put it in a preserving jar with water. Whenever it is dissolved, this is done. If the chunk is not dissolved, you can still add water. And when you do a nasal rinse in the morning, you can buy this nasal irrigator that looks like Aladdin's magic lamp. Then put this Himalayan salt solution in there and pass it through the nostril. And then you will see how it goes out here on the other side. It's wonderful if you get used to it. Then you can do a lot for the stability of the nasal mucous membranes for the child, or for many other people who do not have high blood pressure. You first have to think about what's going on locally with my mucous membranes. You can see it here. You have no view of the mucous membranes anywhere else. A company called Heal Ha, a drug or homeopathic remedy, a complex remedy, that is the mucosa compositum, and I am very, very happy to give this to patients, also as an ampule which can be wound up and put into the nose without a syringe and then can be sniffed in. You can also suck on the mucosa compositum as a tablet 3 to 4 times a day to give your mucous membranes more firmness and to prevent this nosebleed as well. Sometimes they are just episodes in the context of our additional workload, stressfulness. Not yet adaptation. And with that, you can actually get a bit of an annoying problem under control very quickly. But it also shows that you can actually treat it very, very well. So that would be it about the nosebleed. Another question came from a patient from Switzerland, a young woman who keeps saying, I can't take it anymore. I can't cope with it anymore. I have such digestive problems, especially frequent cramps in my stomach. And above all, insane flatulence and cramp-like pain. I sometimes get it when I've eaten meat. Any intestinal discomfort, anything deviating from normality, always needs to be looked at. And looking at it, that doesn't mean a colonoscopy, but looking at that means you should get a stool analysis, please. A stool examination that will help you to observe what is actually no longer imbalance here. And meanwhile, the mouth as a chewing organ is not used by most of the people in its function because they eat very quickly and gorge. There is so much ptyalin here, so much enzymes in the saliva that would actually pre-digest the food for the stomach. That doesn't happen anymore. We gorge. And now it is here. But only part of the food is actually broken down. by the enzymes that work in the stomach. These are trypsin, chymotrypsin, and of course that's stomach acid, but its main task is to destroy parasites, fungi, bacteria. And then the stomach opens and sends it to the small intestine. The small intestine is a part of our body that is of great importance and actually is not at all perceived as such because it's hardly visible. We either just focus on the stool or concentrate on the colon during a colonoscopy. But it is the small intestine that decides whether a regular, effective, valuable breakdown of food can take place. And when we have a pH in the stomach, I hope everyone knows what a pH is. This is the concentration of the hydrogen ions and is a measure that a solution is either acidic, neutral or basic, under 7, 7 or over 7. So you need to know that the stomach has a pH of 1.4. And only when it has 1.4, the stomach will be able to do its job. There will be no one in the world who has a problem anywhere that has a healthy environment here. But there are a lot of people, and I can't tell from this now, who have belching over and over again and stomach acid over and over again, and they take Pantazole, a stomach blocker, in the sense of a proton pump blocker that blocks gastric acid production. Well, but what happens then? Then it does mean that the pH is slowly moving into a higher acidic area. And the function of killing bacteria, fungi, parasites will no longer be possible for the body or the stomach. This means it lets them through into the small intestine. The other thing is that when the stomach loses its milieu, it affects the production of bile, of the pancreas, and also on the milieu, because the milieu of the small intestine is also dependent on stomach acid, as well as sufficient bile, as well as sufficient pancreatic juice. And if this milieu of the small intestine does not have a pH of 8.5 now, you have to imagine that this leap that the body is doing, it can't generate the enzymatic power that it needs for the enzymes, the active ingredients supplied by the bile, the pancreas, lipase, amylase, to carry out this breakdown process. That proteins become amino acids, that fats emulsify. That only happens when the pH is 8.5, and there we have this questioning how my stomach is. How well do I eat? How well do I break down? Do I also have caught parasitic loads in my small intestine, which also cause this gas, this pressure, these things? And that is something very important, because when the body feels that it can no longer do this splitting process in the small intestine, then it gives a response to the pancreas and the liver with the information, don't raise the pressure so much. I can't even begin with anything. And it starts to reduce pancreatic and biliary capacity. It's a metabolic economy. The body will never do more than it has to. He always does the best, but he never randomly wastes energy in a process from which it can decide it won't work here. And it's very important that you know this, because the majority of our microflora are lactic acid bacteria. These are lactobacilli, bifid bacteria that are not found in yogurt. In yogurt, it can't survive the sour stomach passage at all, but you can find it in sauerkraut juice, in fermented vegetables, in apple cider vinegar, for example, organic apple cider vinegar. That is the milieu that this small intestine also needs in order to keep it acidifying itself slightly. but with its bacterial power to produce enough of the right spin lactic acid for us. And if I, let's say, eat something and I don't have the chance that my body can properly, let's say, split up, then it can only pass it on. And now the body is also inclined to discharge it, and that will always happen through cramps, and the cramps always go towards the exit to get rid of burdens. That can be a symptom that leads us there. Excuse me. Another thing would be that you have to check whether you are parasitic, because very, very many parasites that have really found their habitat, who have established themselves first of all, who have created a biofilm where they can establish themselves well. That can be worms, and not only hookworms, but also roundworms. We see them a lot. Dog tapeworm, fox tapeworm, that can be the fish tapeworm by eating sushi, which are almost 17 meters long. This is a large number of protozoa and parasites that won't leave easily. And when they are established, it is important that you know what you're talking about, that you're actually doing a parasitic diagnosis, please, not through the stool. We see 85-90% negative, but can then prove them through resonance measurements. Please look for someone who has dealt with these things a lot, can make a very good diagnosis of parasites through bioresonance or electroacupuncture, to then know how to be able to get rid of the parasites. And then everything looks very, very different again. Of course, parasites also consume vitamin B12 and proteins, and you just have to know these things. We always recommend a so-called colon cleanse to patients in advance. It takes 3 to 6 days, and with this colon cleanse, that then removes biofilm that has covered the intestinal mucosa. A completely different functionality is possible for the intestine, so that the intestine or the intestinal mucosa can properly colonize itself again and thus restore its functional strength. The company Vitamunda has this colon cleanse program. We've tried many other different things, but that's actually the nicest. I remember a patient that had constant stomach pain, flatulent, for already 10, 15 years, a really great patient that had lung cancer in the past, is still wearing her defibrillator, but brought her heart back to such a healthy stability years ago that she now has completed an 800-meter climb with me, and I did the colon cleanse with her. And it was like a birth. It was like a birth, and what was discharged and released, that was sensational. It was like breaking free. And that is also a consequence when I notice that it no longer regulates here. Spend some time on these things. Do a parasitic diagnostic. And finally, please, see if you metabolize the histamine well. Histamine is a biogenic amine. We produce it ourselves. We also take it in when we eat tomatoes, cheese, meat, substantially loaded with histamine. And this histamine has to be broken down. Histamine has many functions in our organism. Histamine is a big issue in the context of allergies. But if you have a diamine oxidase deficiency, you cannot break down histamine and thus provoke inflammation and cramps. There is a website, histamineintolerance.ch. I couldn't explain it that well. What is related to histamine? The many, many symptoms. And a diamine oxidase deficiency, an excessively high histamine load, stays unfortunately very, very often undetected. because, for example, there is also insufficient vitamin B6 and zinc. Patients have HPU cryptopyrroluria. We have already talked about this clinical picture. And then they are not able to build up this enzyme sufficiently. If there are enzymatic questions behind it, that the pancreas is now producing too little enzymes, you can bridge the gap with pancreatic enzyme, which you can see in the stool analysis. But it is not ostensibly the first step, because it will deprive the pancreas of the strength that it will regain its own strength tomorrow to produce enzymes, because when the body notices that there is enough in the system, of course, it goes back with its own function. And that is why the topic of abdominal pain is to be seen multifunctional here. But don't live with it. Every child who has an emotional conflict, of course, also has a stomach ache. You always have to address this level in patients too, who react first of all with their stomach, and put more magnesium in the system to have an antispasmodic effect. But go on this very interesting journey and let these things be clarified bit by bit, to what extent the intestine needs your help. And sometimes there is a lot in a little at that moment. We have a lot of experience with therapeutic fasting, with liver detoxification, and sometimes that's the first step. To open a new door where the body can first relieve itself so that it can consolidate and build up its own structures again tomorrow. And we can all get into this situation. Our food is no longer just reduced to the essentials, but the things we take in can sometimes overwhelm one or the other organ or provide the basis for a derailment. But it is solvable. Thanks a lot. I'm already looking forward to next Sunday. All the best. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.